my views on a very common topic, that is hypertension. Hypertension is one of the most common problem in our country, as estimated 1.28 billion adults aged 30 to 79 years worldwide have hypertension, and 46% of adults with hypertension are unaware that they have hypertension. Next is the definition. Hypertension is a condition in which blood pressure in the arteries is chronically elevated. Systolic pressure is above 140 mmHg and the diastolic is above 40 mmHg. It is called silent killer because usually do not have symptoms when blood pressure is high. Next we will discuss about the types of hypertension. Hypertension is of two types. First is the primary and next is the secondary. Primary hypertension. This is the most common form which occurs in adult 90% cases. The cause is unknown, but there are some factors which cause hypertension, that is the salt intake, tension, stress, lack of exercise, smoking, obesity, metabolic disorders and excessive consumption of tea and coffee. But these are the modifiable factors. There are some other factors like family history and age, but these are the non-modifiable factors. Next we will move to the secondary hypertension. It tends to appear suddenly and cause a higher BP than primary. Various conditions and medications can lead to secondary hypertension, including stenosis of renal arteries, that is the narrowing of renal artery, pregnancy, oral contraceptive pills, birth control pills, painkillers, illegal drugs such as cocaine. So this is all about the types. Next we will move toward the sign and symptoms. When a person having high BP, then what sign and symptoms are appear? Usually it comes no symptoms and label as silent killer, but sometimes it may develop severe headache, blurred vision, nausea, vomiting, fatigue, confusion, epistaxis, that is bleeding from the nose, chest pain, shortness of breath, irregular heartbeat. Next is the diagnostic evaluation, that how we will diagnose a person having high BP. The best way to check the hypertension is to check the blood pressure of the patient. In addition to this, we can collect the history of the patient, include the symptoms which I have told you earlier, and the family history regarding the blood pressure, diabetes mellitus, cardiovascular disease, and the medical history, physical examination. Next, there are some tests we can use to find out and we can diagnose. We are used to diagnose the hypertension, like CBC. It stands for complete blood count, urine analysis, chest X-ray, ECG, that is electrocardiogram, and echo of the heart. If hypertension is not treated, it can cause other health conditions as well as damage the other organs. So uncontrolled BP can lead to such complications like heart attack, heart failure, kidney damage, and torn blood vessels in eye. Next we will move toward the management. Here we can discuss the two management, like medical and nursing management. In medical management we will discuss about the medicines. Some people may need to take medicines. Its purpose is to maintain BP within normal ranges by simple and safe methods. In this we can give diuretics like furosemide, which helps the kidney to remove sodium and water from the body. This further decreases the volume of the blood and it leads to lower blood pressure. Next is the beta blockers. These reduce the workload on the heart and open the blood vessel. For example, atenolol, propranolol. Next is the alpha blockers, alpha beta blockers like labetalol, and vasodilators. Vasodilators we can use to dilate the blood vessels. For example, nitroglycerin. Calcium channel blockers, for example, nifedipine. There are some other alternative therapies we can use to control the blood pressure, like acupuncture, meditation, yoga, some relaxation techniques like music, reading books, etc. Next, we will discuss the nursing management. First of all, we have to explain the risk factors and their influence on various body systems. Next, identify the risk factors. Also, we have to encourage the patient to consult the dietitian for diet plan to reduce the weight loss, which consists of restricted sodium, because earlier we also discussed it is a causative agent for hypertension, and more intake of fruits and vegetables. Also encourage the patient for regular physical activities to minimize the stress and anxiety, provide psychological support to the patient, and last is instruct the patient and family for medicines and follow-up. Last but not the least, there are some lifestyle and home remedies we have to use to control the BP or to reduce the hypertension. First of all, we have to advise the patient to eat healthy diet, healthy food, decrease salt in diet, maintain healthy weight, because obesity is also a causative factor for hypertension. And next is increase physical activity, limit the alcohol, and do not smoke, manage stress, and last is practice yoga and meditation. It reduces the chances of hypertension. So this is all about the hypertension. We have discussed in this the definition, types, causative agent, sign and symptoms which appear during the hypertension, and also how we can diagnose the hypertension. And at last we have discussed the medicines, nursing management, and some home remedies to control the hypertension. Thank you.